I am Ellen Marie Whalen, Associate Director for Health Policy at the Center for American Progress, and this is how health reform really works. The healthcare system builds on what works and fixes what doesn't, and people will generally fall into three categories. The first category is if you're covered by your job, and this is the way the majority of Americans receive their health insurance. If you're covered by your job, you'll keep that insurance and it won't change. But in fact, the healthcare bill does a few things that'll actually make that health insurance even stronger. It'll ban annual and lifetime caps. It will eliminate the ban on pre-existing conditions. It will require all preventive services to be paid for without a copay or a deductible, and will allow young adults to stay on their parents' plan until they're 26 years old. The second way individuals will be covered will be under a government-sponsored plan, such as Medicaid, the program for low-income or poor Americans, and Medicare, the program for senior citizens. The Medicaid program is a program that's now administered by the states. That'll be strengthened by having every state administer it in a much more similar way. We'll also expand that program for 16 million more Americans. The bill will strengthen the Medicare program by extending its solvency for about another 9 years without cutting any benefits. And also, very importantly, we'll begin to close the donut hole. The donut hole is the period of time that senior citizens now have no coverage for their prescription drugs. The third way that individuals will be covered by the health insurance bill is by a brand new system called the exchange. The exchange is a brand new marketplace where people now who don't have coverage by their employers or elsewhere will be able to join together to buy insurance. Currently, individuals, families, and small businesses who purchase health insurance coverage outside the bigger employer-sponsored insurance plans are forced to pay exorbitant prices since they cannot exert the purchasing power of a large group, such as a large employer. What the new system puts into place is a state-based health insurance exchange. These are basically new insurance marketplaces. In these new marketplaces, individuals, families, and small businesses can join together in larger risk pools to purchase private health insurance coverage at affordable prices. Private insurers will compete for business based on cost and quality and will be held to the same standards as large employers are right now. So the second major part of the healthcare reform bill is why we need to cover everyone with insurance. The current health insurance system allows insurers to deny coverage based on a pre-existing condition. So if you have an illness, an insurance company can say, I'm not going to provide coverage to you anymore. The new system would require insurers to cover everyone, healthy or sick. If insurance companies are required to cover individuals with pre-existing conditions, but everyone is not required to have coverage, then healthy people could go without coverage and only sign up when they become sick. This would leave insurance companies with rosters of the sick. That's expensive, and premiums would skyrocket for everyone. Health insurance only works when lots of people pay into the system. The healthy help pay for the sick, and the risks and costs are shared by both the healthy and the sick. But the system has to be affordable if we're going to make everyone pay into it. And of course, this begs the last question, how are we going to pay for this? This new system is expensive. It will cost about $940 billion over the next 10 years. But the bill also provides provisions to make sure it's fully paid for. Most of this money will be used for affordability credits, tax credits that will help individuals, small businesses, and family purchase insurance if they can't afford it. This healthcare reform legislation includes provisions that will help slow the growth of healthcare costs. Overall, it will help reduce the nation's deficit by over $100 billion over the next 10 years and cut the nation's deficit by over $1 trillion in the following decade. Much of the money that we're using to pay for these changes will come from just paying closer attention to how we currently spend over $2 trillion in the nation's delivery of healthcare. We will save money by eliminating waste, fraud, and abuse in current programs, better coordinating the care that Americans are receiving, which will ultimately reduce preventable hospitalizations and duplicate tests, better utilizing electronic medical records, and paying for quality, not just quantity and additional services. It also raises additional money by charging insurance companies a fee to help pay for the new reforms and making sure the wealthiest Americans pay their fair share of Medicare, while lower income beneficiaries pay less. And that's how healthcare reform can ensure better care for all Americans while ultimately reducing the nation's deficit.